So this is section 2 of lecture 1, which is addressing how one develops a research question. In this section, we're going to be talking a little bit about how you design a problem statement. What are the components that go into it, and what does it accomplish in the context of research? Now, the introduction can be described using different terminology. Problem statement is actually fairly synonymous with an introduction, and usually a major component to that problem statement will be talking about the variables in the study as well as the population that's going to be addressed. So the major role of a problem statement in a research paper is discussing what the actual evidence is out there that supports this research project as being significant and explains why the researcher took the approach that they did in addressing the question. It also will give a reader an understanding of what research has already been done in that area so they can see this work within context. So what does this typically include? Well, first off, it's typically several paragraphs long. A common length for most papers is roughly around 5 to 7 paragraphs. But you'll see a wide range. So some studies you see 1 paragraph or 2 paragraphs. Some studies you'll see as many as 5 or 6 pages of introduction. So that does depend. But what tends to stay fairly consistent is the components of it. So the researcher doing it is going to try and lay out the background for the question that's going to be addressed so that the reader is on the same page. And in doing so, they'll cite relevant literature that tries to explain what work has been done in this particular area before and allow the reader to understand how the work that's being proposed connects to that previous body of literature. The researcher will also talk a bit about the different variables or questions that are going to be looked at during the study. And we'll talk a little bit more about variables later in this talk. They'll also give some idea of what population is going to be addressed. So that, and usually giving information about that population and the demographics and the specific needs of that population. Overall, what it's trying to do is really give the reader an understanding that this question is significant. So there should be enough data there about the health issue of interest to make one think, oh, well, this is something I actually want to read, or at least I would understand that this is something that matters. In some cases, you also see a researcher will talk a little bit about the feasibility of what can and cannot be done in the paper. A problem statement will actually typically end with some sort of question or declaration about what is actually going to be accomplished in the study. And we're going to talk about that a little bit more in the next section. So problem statements for quantitative and qualitative research actually vary to some extent. For quantitative research, it's really focused in on explaining the variables that will be looked at in the study and talking a little bit about how they may or may not relate to each other. It also really tries to discuss what's the relevant information about the population of interest and suggest how the inquiry will go forward. So is the goal to compare different populations? Is the goal to test a certain intervention? Is it to evaluate a certain clinical approach, etc.? So that's what a problem statement will be structured like for quantitative research. Qualitative research is somewhat different. Qualitative research will talk more generally about a general phenomenon that's going to be addressed, some sort of experience or understanding that the population of interest has. It will usually spend a fair bit of time talking a little bit about the research tradition that it's founded in. So we'll talk about those different approaches, be it grounded theory or ethnography at a later point, but it should in some way give you some idea of where the researcher is coming from in asking their questions. It should actually spend a reasonable amount of time talking about the population that's being addressed, especially because of this type of research really being very dependent on the population that's being talked to. And it will talk a little bit more at the end about what the inquiry will address. Is it to describe something, discover something, or explore people's experiences in some way or another? So let me talk a little bit more about the components that you would expect to see in a problem statement, particularly the populations of interest and the variables to be addressed in the study. One of the major tasks of an introduction is to introduce the population that's going to be addressed in the study. Now, a population is pretty much what you would expect. It's a group of people that's going to be addressed. So examples of this might be teenage addicts or elderly individuals with dementia, etc. Now, during the introduction, what the researcher really wants to do is give the reader the information that they need in order to understand why this is a population that's going to be focused in on. So what are the particular health needs of that population? Why are they particularly interested in looking at this population? Do they have particular cognitions, or is there a particular need for this data because other studies haven't looked at it? Also, what are other factors and distinct traits of this population that might be relevant to understanding why they respond the way that they do to this health condition, for example? So, during a problem statement, you're really trying to give all the information that the reader needs in order to understand why the population was chosen and what the characteristics and needs of that population are. A second element that introductions will almost always include is a discussion about the variables looked at in the study. So a variable is really an attribute or property that various topics of interest within the study can differ by. So what I mean by that is, it could be whether someone has high or low blood pressure. That would be a variable, something that can be different for different individuals. So it can be characteristics of people. In some cases, it could also be different events. So a variable could be whether or not an intervention occurred, or whether or not a certain emergency disaster happened in a certain location. It can also be objects. For example, if you were to study within a hospital whether or not they have first aid kits located in every hallway, that might be your population in that case might be actual objects rather than people. So one of the responsibilities of the introduction is to actually define what the variables are that are going to be looked at in the study. Now, the way this is done is going to differ between qualitative and quantitative research. Qualitative research really is focused in on a phenomenon and experiences of individuals. So if you're looking at, for example, exploring how people think about cancer, the experience of having cancer, the introduction would talk a little bit about the different concerns that research shows people have in the context of the experience of having cancer. They often don't use the terminology of variables when talking about this, but they may in some cases. Quantitative research is somewhat different. It almost always does use the terminology of variables. This is because quantitative research really is focusing on measuring different traits or experiences using numbers in some way or another. So the responsibility of the introduction is to really explain how and define what those variables are. So an example of this would be, you can take a general conceptual idea like intelligence and say this is something that we want to study, but really intelligence is a huge idea, it's a huge concept, it's very broad. If we surveyed everybody in this class, everybody would have a slightly different definition of what that meant. So in order to actually measure something, you have to operationalize it. And by that I mean you have to have some sort of test or way of studying it. And an example in this case might be an IQ test. Now, an IQ test in this example is often controversial. So is an IQ test actually a good example of intelligence? And that's the types of controversies that might be addressed in an introduction, where a researcher explains why they're picking a certain operational definition of a general conceptual topic, so that the reader can understand why they've chosen it. Typically, you also see a bit of discussion about this in the methods too, which we'll discuss later. Some other terminology that's actually fairly helpful to understand when you're reading papers is the idea of independent variables and dependent variables. Now, this is only relevant, again, for quantitative research, but it is important to understanding how one would design a study of that sort. So what is an independent variable? Well, it's typically something that has an influence on the outcome, the health outcome that you're interested in. It's also something that can be manipulated, that can be affected by the design of your study. So either it can be manipulated by changes in design, or it could be something that varies naturally within the environment. So what are some examples of this? Well, it could be food. So you could have different diets that you're offering to your patients and seeing how that affects an outcome. Or it could be medications. Does this medication or that medication have a better influence on pain management? Or it could be some sort of educational intervention. Does having this type of educational pamphlet versus this kind of educational in-person training have a better impact on health outcomes? Or an example of a naturally occurring variable, independent variable, would be something like patient income level. This is something that you're not changing yourself, but could be used as an independent variable if we think that it may affect our ultimate health outcome. Now, what is a dependent variable? Well, a dependent variable is really the outcomes that you're interested in. So this is a variable that you believe will be influenced by changes in the independent variable. Now, it's important to note that a dependent variable typically is not manipulated in the study. So, for example, you're not deciding whether you're going to have heavier and lighter people come into the study. You're going to manipulate the food intake, and then at the end of the study, you might see, okay, what is the outcome? What is the impact of doing this health intervention where you manipulate food intake? So the outcome is not actually manipulated itself. Another example would be pain. So you're going to be manipulating whether or not someone actually gets a certain medication, but the outcome, the thing that the dependent variable, is not manipulated. You're just going to have your outcome measure, okay, how much pain is this person? Or in the example of education, you might just be looking at how much does someone know about a specific question? And you ask, okay, did they receive this type of educational intervention or that type of educational intervention? So that's what dependent variables refer to. And this is pretty important for understanding the structure of a quantitative study. There are actually a number of other terms that will be used for variables, and I'm going to talk a little bit more about this at a later point, but I did want to give you some ideas for what they are, because this will be mentioned throughout papers and as we're talking in this class. So what is a continuous variable? Well, a continuous variable is one that is essentially a spectrum. So height is a good example of this. So you could pick different increments in which to measure height. It could be centimeters or it could be millimeters. So there's no real absolute interval in which one can use to measure this trait. A discrete variable is something that there really is a sensical number to things. So an example of this would be, say, number of children. It doesn't really make sense to talk about half of a child, right? So that would be an example of a discrete variable. Another type of way of breaking down variables is the way that they're structured. So an example of ordinal variables is ones that have a ranking. So you could look at socioeconomic status, and you could have different intervals that have a common sense structure to them. So you could have lower income levels, medium income levels, and higher income levels. Categorical variables are ones where there is different categories that are looked at, but they don't necessarily have a structure to them. So you could look at hair color, but there's no way to rank red hair color versus black hair color versus blonde hair color. They're just conceptually different categories with no conceptual order. Then there's also dichotomous data. Dichotomous data is really either or information, yes or no information. So, example of this, does someone have U.S. citizenship? Well, yes they do, or no they don't. Other types of variables to think about are extraneous variables. So these are variables that could influence a factor. So if you're using a person's ability to pull on something as a measure of strength, their body weight might be an extraneous variable that you want to look into, because having more body weight might allow them to pull something with more force. So that might be something that you need to control for. Confounding variables are extraneous variables that really aren't accounted for in studies. So in this case, for example, there were studies that linked coffee to bladder cancer. And they were saying, oh, well, maybe you shouldn't drink coffee because it increases your risk of bladder cancer. But they then did other studies which looked at and saw that people who drank coffee were also more likely to smoke more. And it turns out that smoking is actually the cause of bladder cancer, not coffee. So in this case, coffee would be a confounding variable for this actual influence between an independent variable. Another term that's often used for variables is demographic variables. Demographic variables are ones that sort of describe the population that you're interested in. A very common demographic variable is gender. Another example are race and ethnicity. You often look at socioeconomic status as well. So those are a number of different variables that you actually see in a lot of different studies. You won't always see them, but most studies do that. In fact, some of those are almost requirements for getting your papers published. All right. So typically, during a problem statement, you will see some discussion of a wide range of different factors. You will usually have discussion of the variables and questions that are looked at in a study, going to be looked at in the study, and there will also be discussions of the population of interest. Towards the end of a problem statement, you'll also see a description of what the question is in the research that's being addressed. And that's going to be the focus of our next section, which you will see in part 3.